Hi, this is Rich Sanders with the weekly Health Law News Nugget from Southern Health Lawyers for Tuesday, April 17th, 2018. Well, the OIG, the Office of the Inspector General at the Department of Health and Human Services, had a big day on Friday, April 13th. It issued its annual report to Congress, and in the process, Secretary of Health and Human Services Azar gave a round of applause to the OIG's enforcement efforts. In fiscal year 2017, dollars recovered by OIG as a result of its civil and criminal law enforcement activities were $2.6 billion. It's great news for taxpayers. Obviously, the OIG has been working hard and is successful and effective in its efforts. And Secretary Azar said that for taxpayers, this is a terrific return on the investment because for every dollar spent on law enforcement, $4 are recovered. That's significant too, everybody, because it shows that the pace of enforcement activity from the Office of the Inspector General is only continuing to increase. While there are over 1,000 pending cases on the civil side, and I want to say something like 400 pending on the criminal side, OIG in fiscal year 2017 opened up over 900 new civil investigations. And so when the OIG has the capacity to literally nearly double its workload in terms of the civil investigation side, that's worth taking note. What's it mean for Health Law News Nugget watchers here who represent hospitals, physician practices, all manner of providers, and pharmaceutical companies and device manufacturers? I think the two important takeaways are that the OIG is successful and effective, and so your compliance plan needs to be just as successful and effective in order to ensure that your organization is not committing any activities that the OIG would be interested in investigating. The second thing is that compliance officers who over the last 10 years have really increased their professional efforts and their efforts at developing compliance programs nationwide should really steel themselves, because the enforcement activity in Washington and in all the regional areas of the Department of Health and Human Services is only going to continue. Thanks so much for watching the Health Law News Nugget. Encourage your compliance officer today. Go give them a hug. It's going to be an interesting year. And thanks again for watching. I'm Rich Sanders with Southern Health Lawyers. Have a great day.